My name is Lisa Stevens. I'm a physician assistant in family practice. I work here at Davis Family Physicians. I've been here at Davis Family for about 6 years. Probably the most fulfilling thing about coming to work here at Ogden Clinic is getting to work with families. I love my staff, I love our administration, but really I love my patients the most. I have the best patients. I get to take care of families like I have a little baby right now that's just a few weeks old, and then I have a 99-year-old grandma that we take care of. Just, and all multi-generational. It's the best. I think a lot of things that help me connect with patients is my background. Like I grew up with a single mom. We grew up in Kearns. We were poor as dirt. I can relate to a patient that can't afford their medicines or that doesn't have a father figure there. You know, those are things where I feel like I truly understand what it's like. And also I have chronic illness. You know, I have lupus, and so I went through chemotherapy and I went through all of these things where, you know, I have a patient that comes in and they're afraid to what lies next for them, and I can say I've been there. I totally understand, you know, that apprehension to even continue down that path. COVID was really hard for us. It was slow at first, and then it just came like a whirlwind. And so we were so emotionally and physically exhausted by the end of the day that, like, literally we would cry on our way to work, me and my nurses. Like, it was so hard anticipating coming in. Like, typical day for me is 20 to 25 patients, and we were having days where we were seeing 50 to 70 patients, and all of us here were doing it. Like, we'd have 30, 40 walk-ins that needed COVID testing and reassurance and treatment, and I mean, it was exhausting. We did it, most of it outside, because we were really strong about keeping well patients from sick patients, and so we would be outside standing in a snowstorm trying to reassure a patient that they weren't going to die, you know, or that they wouldn't be able to, they couldn't give it to their husband, or different things like that. You know, I can tell you the emotional tax was so difficult. You know, I had patients that gave it to their dad on chemotherapy and just were sobbing about how, you know, the impact. So it was really hard. And so now when I have patients that are like, worried about the vaccine, it's like, oh, we can't go back to where we were. Please get the vaccine. Super important to me is my family, that we serve others. And so I volunteer at Seager Memorial, which is a homeless shelter in Ogden, and they run a medical clinic. And the best thing about that is getting to work with other people who are like-minded, that want to serve and improve society. I work with Junior League. They have a medical thing as well that we do every year. And then just other types of service. You know, we volunteer as a family at the Lantern House. My daughter organizes Red Cross blood drives every 3 months. So yeah, it's super important to me that as a family we are giving back. I'd like to be remembered for the service I gave others, or the change that I instigated in someone's life. I'd like to remember for the fact that I made a difference.